There are many human struggles and medical issues related to a life-threatening illness. The emotional and spiritual struggles of a patient with a short prognosis are often overwhelming. Once associated with only cancer patients, hospice now provides services that offer comfort and reduce the suffering of any patient battling a disease or condition that can no longer be treated.
The most common misconception of hospice care is that hospice is a place, when indeed it is just a philosophy of care. It's primarily done in the home. So the inpatient unit is used short-term for pain symptom management or imminent death. We treat a whole spectrum of diagnoses in hospice care, including cardiac disease, Alzheimer's, Parkinson's, and what we call debility, which is no specific diagnosis, but somebody that's starting to fail.
Many diseases that were acutely life-threatening have shifted into chronic illness, which require different models of care. Hospice is a benefit covered by Medicare Part A and by most insurance companies.
Now that hospice is getting involved longer, although their disease process is still terminal, it may be terminal 6 months from now, we're controlling their shortness of breath, keeping them at home, controlling their pain, keeping them out of the inpatient hospice unit, thus improving their quality of life and improving the time that they have with their loved ones. Hospice care is implemented in a patient who has a terminal diagnosis of 6 months or less without medical intervention. Palliative care, although it is part of hospice, is much more broad spectrum. Patients are still seeking cure, they're still getting comfort, and the palliation is part of their overall treatment plan in addition to curing the disease.
Established in 2005, Serenity Hospice and Palliative Care has provided end-of-life care to more than 7,000 patients in the greater Phoenix area. Its caring staff works to relieve suffering, embrace comfort, and promote quality of life for patients with life-limiting illnesses by providing expert medical care and pain management.
I started Serenity Hospice because I've done this for 15 years working for other providers and didn't feel that the quality of care and the standards that I wanted to provide was in the companies that I worked for in the past. I thought that what was lacking from other hospice companies was that individualized care. If they needed a few radiation treatments, we do a few radiation treatments. If they needed a few physical therapy treatments, we do some physical therapy treatments. So we meet the patient at the point of their need.
The only nurse-owned hospice agency in the state of Arizona, Serenity Hospice works with the patient's attending physician and family caregivers, developing a customized plan of care to address the needs of the patient and family.
The standards at Serenity Hospice are very high because we're nurse-owned and operated. So I'm involved in every aspect of the patient's care, including the hiring of the nurses, the hiring of all the employees, and putting together high protocols. At Serenity Hospice, we offer a wide range of services, including the physician, the nurse's aide, social services, bereavement, and also volunteer services.
Built on a 60,000 square foot campus, the Serenity House layout features contemporary design, hardwood floors, floor-to-ceiling glass windows, lush landscaping, and oversized patient rooms, complete with private bathrooms and adjoining outdoor patios.
We decided to offer luxury with this facility because we wanted people to enjoy this warm, welcoming environment while they were going through such a challenging thing in their life. Most hospice facilities are dark and dingy, and we wanted to stand out differently than all the others and make it light, bright, warm, and welcoming. The feedback that we're getting with the Serenity facility is amazing. People love the environment, love the facility, and there's casitas available. So if somebody doesn't want to stay in the patient's room, they have a place to go to. And there's nowhere else in the nation that is doing that right now.
About a year ago, my mother was diagnosed with lung cancer, and with that lung cancer, it actually metastasized to the brain. So after all the chemo treatments that she had, the doctors actually could not give her chemo treatment any longer, and at that time referred us over to hospice care for her. We were referred to Serenity Hospice, and so happy that we were, because from that point on that we made that call to Serenity, my mom received the most amazing care from the nurses, being by her bedside, just giving her a much better quality life. It made so much sense to have hospice there with us because they are fully aware of what takes place during this time with the patient and the families. And I mean, it really made my family feel like we were also being taken care of.
Similar patients with similar diagnoses on hospice, in most cases, will live longer than patients that forego hospice. There's a misnomer, a misunderstanding that hospice patients need to be brought into an inpatient facility, when in actuality, less than 10% of our patients are in the inpatient facility at any one time. It's here and available to them for acute issues that may be needed during their dying process, but our goal is always designed to get the patients home with their family. We also have close contact with our bereavement coordinators and social workers after a patient passes to have continuity of care and support the family, not only the patient.
Originally, we were with another hospice. We were referred through a doctor, and at the time, we just didn't feel that the level of care was to our standards. We were referred to Serenity Hospice, and from the moment we made that call, it was seriously like night and day. I had nurses there. We were, paying attention to my mom, knowing exactly what she needed and what our family needed as well. So there was a large difference there, and it really made all the difference in the world to my family and I.
Serenity Hospice is excited to be opening a facility in the West Valley, and we're also excited about our expansion to Tucson, providing the best quality hospice care.
As a medical director of an inpatient hospice facility, and also as a physician taking care of acutely ill patients in a hospital setting, I do have appreciation and enjoyment from caring from both populations. Yet on hospice, I have a lot more appreciation that I'm making someone comfortable in the end of their life, helping them stay alert, stay comfortable, enjoy their life, and enjoy their time with their family.
The entire staff with Serenity Hospice just treated my family so amazing and took such great care of my mom, so I knew she was in good hands. I just found that the quality and level of care was 100% what I believe a hospice should be.
The message that I'd like to get across to viewers is don't hesitate, don't wait, don't be fearful of the word hospice. Call today and get that great, amazing service.
When time is short and medical science has no more to offer, hospice is a family affair that offers the promise of comfort. Learn more about Serenity Hospice, hospice care the way it was meant to be. For more information, go to serenityhospiceaz.com or call the number on your screen.